So welcome to our first podcast, and here we are having with us Dr. Souvagya, where we will discuss about what to do after videos. A very known question, but the discussion is that what are the realities which are not often discussed, and today we are going to discuss it one by one. So let's start with it. So welcome Dr. Souvagya sir
Thank
to
you
this
so
first
much.
podcast of us.
Thank you for welcoming me again and again.
Yes.
Because I know that you are welcoming me to the clinic to do some small cases. I'm very happy. And I'm really happy that you have
We
thought
are
of this.
connected through the cases, and today we will discuss the realities that what exactly after the videos, which is a very known question. We often discuss it on social media platforms and clinics, and many of students come here to ask us about it. But today we will discuss it in a very far way, and let's start with it.
Sure.
Sure, sir?
Yeah, I'm ready for it.
Okay.
It's our lifestyle only. After videos, we have traveled a lot.
Yes.
So you can ask the journey just for
Yes.
us.
So first, after beginning the question sessions, it is a long question session. I will first take the public who is working here. I will let them know what is your experience, how you have come so far, and what your suggestions get this question.
So, are these questions filtered or to the real answers? Because
It should be very real, and it should be very.
because I can't speak something like it is very possible because the brightest side of the sun,
Yes.
right?
That we just need the unfiltered things.
So what is the question?
Question is what's your experience that you have come so far after videos, MBS and many more courses. So what's your opinion and suggestions to the students who are completing their videos and after career path, the realities of the career and everything?
So my opinion for the students,
Yes.
for the doctors,
Yes. That everybody doctors.
see it is very clear. Once you become a doctor, your duty is to serve and you start serving to the public, the clinical level, in the hospital level, and the more you serve, the more you get experience. Of course, you have a good livelihood out of it, a good life of course. So we have to be very much particular in serving or treating cases. That should be a prime for the newly got dentist. That is my opinion.
So after completing videos, can you do you think any more courses is needed to make the career more brighter and any path you can suggest?
So, see, I will tell you like when a tree grows, the most important part is the branch. Okay, so as a dentistry can be considered to be a big tree or a big banyan tree, and there are many branches in dentistry, sub-branches, specialty, subspecialties. As a whole, I want to say that dentistry is a specialty. One has to think specialty in terms of specialty in treating the case. It's not limited to the compass of the scope of the landscape of food extraction. One has to think beyond it. We need to remember again and again what's our aim, why we become a doctor, what is the difference between a doctor and a dentist, how both are same, how both are different.
Yes.
If I'm not getting very much wide, I think this can be a good answer.
Yes. So now the $1,000,000 question every student after videos ask, is MDS really compulsory to achieve that success or achieve the path of growth after videos? That's the question today.
MBS is necessary, that I know, is a mandate.
Yes.
No doubt it is necessary for us. But the journey to achieve MBS should be very special in everyone's life. We should not be time bound. Because we as a surgeon, as a dental surgeon, we are very great in doing our treatment. Everyone should be great. While reaching the effects of MBS, seemingly to be the terminal part of dentistry in terms of academics. Nowadays people are going for PhD also.
Yes, yes.
But that journey should be beautiful. It's not that a success failure
Yes.
Switching on the button or switching it off. No. The journey to achieve the next degree, the next specialization degree, should be very much enjoying for the dentist. It should not be limited like if I am preparing for MDS and I am completely thinking of the fact that no,
I created at a hospital.
it's a goal.
Yes.
But achieve it, you might end up being a good surgeon. Basic thing is you have to be a dental surgeon. That is the basic thing as required by the public. And this is a far more than learning sciences. It is application of sciences.
Like the journey you said, the word journey. From my perspective, that when I had completed BDS, so the question was, should I join MDS just after completing BDS, or should I give some time, or should I study more? I need to give some time in clinics, then join MDS. Like, what's your opinion on this matter?
It's first come, first serve. Once you are into BDS, either you can go round about it and each time you are up straight line to each MDS. Depends on your attitude and attitude, both. You have to study, reach your goal, and enjoy the period of time of 3.5 years, 3 years, and again 5 years in some states and all. So you have to just enjoy the curriculum so that we get more and more learning. MDS is a program, but the actual program is the experience. What the dentists get.
That's the main thing of the curriculum.
Yeah.
So, apart from MDS, some other paths students can opt for and go for. If the MDS is not the choice, like many students nowadays.
In dentistry,
Yes, in dentistry.
see, I will tell you very frankly, dentistry has grown leaps and bounds in the past. Now, dentistry can be treated as a core specialization and the practices there are many. So, if you come down to semester specialization or off branches, you can.
If they continue to do the clinicals, you can say
Clinicals is one part of the dentistry.
yes.
It's not limited to that.
Yes.
So, clinicals, it can be like a dentist being a surgeon to go to principles of surgery. And it can work accordingly. That's the base route. But one can choose a career in terms of academics and go for research and development. In terms of administration, and go for hospital administration. And one can choose, some subspecialty also as per the demands of level. It can go for that. And very popular, it is more about the public health master, if that was it. That's something which can be.
Very well.
So dentistry is just like getting diversified, not a single brand. It is the starting point, so it can be anywhere in the life. MDS is one of the goals.
Sure. So, like the question, other question is, we are seeing in like market, there are many courses available after you complete BDS. In social media platform, we see on daily basis the short-term courses, one-day courses, 1 month courses. Many of clinicians and universities are providing it. So, what's your view on that?
My view is very simple in that you can take up any courses, but learning is completely personal.
Like how they can choose a very good course? What are there some guidelines regarding it?
Practically speaking, there are no guidelines to choose a course. It requires your mentor expertise.
Yes.
Is your mentor expert enough to teach?
Yes.
Is he a logistic or a surgeon? How it is important?
Yes.
How he is going to explain you? What steps he is going to teach you?
Yes.
What are the grades of and steps taken by him to educate you about that? These things are very important. So it can be a peer value also. You can ask your friends, you can go to the website and Google and try to know that who can help us in honing our skill. But your courses should not be limited after. We should contact a mentor beyond that and choose.
That's some bullet points for it.
If you go for a fellowship in implants, don't be independent after that. Contact an implantologist. Those will guide you through.
Yeah.
A team is required. Fellowship means fellow. A ship means where you have to travel. So in fellowship you need mates, your peers, your seniors, your juniors, your academicians. So everything is a roundabout activity in which you will be guided by a trust. The trust is the academic trust. Yes.
Yeah. that's a very great answer.
Thank you.
And then there is another very bursting question. It's like Indian or abroad for dentistry, obviously.
Okay, see, that's a great point. You know, by answering it, I have to think many things in my back to mind.
Yes,
to
there are
answer.
multi-factors for it.
Yes, but I believe opportunity, if it knocks at the door, open the door. If you feel like you are planning to go abroad, choose your country. Check out for the country relationship, present moment of time. See is the country industrializing or the growth in mental field or academically required. You choose your university if you have to do their plan something that way.
What are the chances they are giving in dentistry? That is also very
It's very
important.
important. And we must be clear the why we are going there.
Yes, that's the most important.
If you are going there to join as a surgeon,
Yeah.
same thing. You have to pursue a course, join a mentor, start working. If you are going there in R&D, you have to think about the per capita, the country's growth, which capital country is coming, is the R&D, what is the expense of the government fund is going to the R&D. These things are very important before choosing a country for further studies
Yes, yes.
or services.
So now a question is like, what are some of the tips and ways and like experience you can say? Nobody tells you after you complete the BDS and then you know it later in your life, but you can say that things earlier. So the students who are watching us will let them know and do it, not repeat the mistakes and choose their career path wisely.
Learn your subjects properly. That's the very important thing. And please try to read the index and the reference part of the book and the introduction. Just don't jump to the point. If I'm going to extend to, suppose I am planning to extend a ruler. Let me not start with the inside and outside. Let me think that how does the external side feels after the molar is uploaded. That is very important. Learn the terminology, the way to communicate with your fellow doctors, your juniors, your seniors. That is very important. What we lack during, and please, the most important thing is that educate the patient with possible risks and complications and take a consent.
Patient communication is matters. What matters?
Take a consent. That is very important because you don't know what is going to happen, and it's not that you're doing something out of the black or out of the blue. You're doing something what the patient demands. So to educate him that yes, this is a thing you are demanding and this is what I can offer you. And the most important thing is that, which is very important, what possible risks and complications are there. You will come in the landscape where you are multifactorially affected. Your health is multifactorially affected. So we try to possibly reduce the risk. That way it will be helpful and that's the possibility which I'm kindly actually there.
So before like going to our second episode of podcast, I will let you ask if you can give the correct answer, a very transparent answer for it. If you have a sum of money with you, like 5 lakh or 10 lakh with you, and you are given a chance to choose what you will do after BDS, what comes first to your mind or what you had chosen at that point of time?
See, if I'm having a capital amount with me,
Yes.
and I am planning to do something, okay, I have to be very much frank that basic dentistry what I am planning to give it to the patient. So it is best to be an independent practitioner in the field of dentistry.
Like you want to be independent practitioner.
That's very important for us because
But if like you have chosen some of the like courses and all, then you have.
you need to work as per the need generates. The courses you are going to pursue after dentistry should complement with the case load or the burden of disease. Approximating to you in your clinic. If your clinic is in a place where manufacturers are more, take the help with the surgeon, take the help with the senior doctor, who can guide you how to fix the mandible. That's not a big deal. That depends on that, where you practice. But concept is that the branches of dentistry will always confluent in the log. And that log is the wooden part. We as a clinician are the twig part. Our aim is to help the people, help the clinician and the patient, the clinician both to the approaching the slow clinic. And it's very important for us to do that. That counts.
So before we end it, some more tips and tricks for the students and for the
clinicians. The concept is that start taking advice from your seniors, from your juniors too, because advice is not meant as an order or a propaganda. The peer advice, what we take from our friends, and those things count. The failures to this every dentist, if you start listening to them, that counts. It will help you in growing the clinic. Make friendship and celebrate everything in a great way, so that you'll be able to grow and understand that dentistry is not a piecemeal approach. We have to be very strong in understanding that dentistry is a team effort. A team is equal for this. That's very important for us, because 9 branches of dentistry, more evolving branches, subspecialties, managing the complications in terms of your core branches, these things count. You need to be very much strong in the research and development. Research is not only publication. As I already told you, one need to really understand why, when in research period the wisdom should be there in the mind, how to achieve the success is completely dependent on how you approach for the success. Success is not the post-op, it is always the pre-op. Plan it beforehand, success will be on the tip.
Thank you. With this, we will end this podcast of today's. So basically, we need to learn that you have to understand all the branches of dentistry and all the tips and tricks of dentistry, and then you should just plan it and do it and execute it. That's the more important thing we need to learn. Thank you so much, sir.
Thank you.
I hope we meet in another session.
Yeah,
Thank you so much.
Sure. We should go on.
Thank you.